Us now, Dr. Ed Dominguez. Thank you so much for joining us. I wanted to talk to you more and just to get more information about Billy Joel's diagnosis. We talked about this just moments ago before you joined us. Hydrocephalus, also known as NPH. What exactly is this condition?
Well, Hannah, this is a neurologic condition, and hydrocephalus is a generic term that means increased fluid or water in the brain. The way we can detect it typically is on a CAT scan where we see the ventricles or the collecting areas in the brain. You have one on each side of the brain. These tend to be very large. Now, we often talk about it in children, but in adults, this is what happens. What's unique about this is the normal pressure. Typically, when somebody has increased fluid in the brain, the pressure in the brain tissue can go up, and that can be a life-threatening issue. With normal pressure hydrocephalus, it typically is not high pressure, obviously, and it's not a high-risk situation. It tends to be more of a chronic issue and not life-threatening.
Okay, and you did mention just moments ago how this could be seen in children, so age doesn't quite play a factor in this?
Age does. Now, the type of hydrocephalus we see in children and infants is often quite different than what we're seeing here. Age is clearly a very big factor for NPH. So there are different kinds of hydrocephalus. The kind that Mr. Joel has been identified as having, NPH, is predominantly an age-related, and typically people over the age of 60 is where we see this disease.
Now, are there any other factors that could make someone more susceptible of this diagnosis?
Certainly, about a quarter of patients who have this, and this is a very rare neurologic disease, by the way, but about a quarter of patients that have been described with it across the world seem to have cardiovascular risk factors as well. Now, they're not having a stroke that causes their hydrocephalus, but they do have stroke factors. For example, high blood pressure, coronary artery disease, high cholesterol, peripheral circulation disease. And so we think that this has something to play in the cause of this. We also know from studies in certain countries like Finland, Hannah, that there are families where the risk for this is much higher than the general population. So it has been worked out that in some situations, there are genetic or familial risk factors. So there are several ways to get to the NPH diagnosis. We still don't have one exact common pathway, however.
Okay, so what would the treatment look like for this? A treatment plan for someone who is diagnosed with this?
That's a great question. Everybody, regardless of how you get NPH, Hannah, everybody has the same treatment. It's a neurosurgical approach. There are no medicines that can help you make less spinal fluid or absorb more spinal fluid because there's issues going on with your spinal fluid dynamics. That's what causes NPH in general. The way to deal with this is to take that extra fluid out. But because it's always being produced, you have to put a small tube in place. Neurosurgeons do that. And then they carry that tube down to a part of the body where the fluid can be drained and not affect the brain. Usually that's in the abdominal cavity. So these types of shunts are called ventriculoperitoneal shunts, or VP shunts for short. And pretty much everybody who has early disease or moderate disease will get a VP shunt.
So with that treatment, is this something that can reoccur in your life that would just need to be revisited with your doctor?
Well, that's very interesting. You will need to be monitored for the remainder of your life because once that shunt stops working for whatever reason or is removed, the NPH comes back. And then you can proceed with the progressive dementia and the progressive gait disturbance, which are the two of the major symptoms and problems, complications from having NPH. So you're always going to have that shunt in place. And as long as it functions, Hannah, you should be all right. In fact, the data from the last 10 to 15 years tells us that 3 years after shunt placement, well over 75% of people are doing very well. Now, again, I tell you, it's a very rare disease, so we don't have a lot of information, longitudinal information on patients because there are just not that many patients worldwide with this disorder.
With that being said, what do you think this means for Billy Joel's future, especially as a performer?
Boy, a lot of that will depend on how ill he was at the time the diagnosis was made. So I don't have that answer as far as what symptoms he had. Did he have a worsening dementia? Because oftentimes the dementia is not reversible, but the gait disturbance can be, and some of the other symptoms can also be reversible once you place the shunt. But as I mentioned, the chance of having disease-free symptoms or disease-free state for about the next 3 years or so after shunt placement, assuming he's caught early, are very high. And that means he may well be able to return to the stage and continue entertaining people, maybe on a more limited capacity, again, depending on his symptoms right now, but hopefully at full capacity. I know a lot of people love his entertaining shows.
Well, thank you so much for this update, just allowing us to get a little bit more clarity and understanding of what this all means. Of course, whenever we hear our favorite artists, when they're diagnosed with something and they're canceling all of their shows, we start to tend and think the worst. But thank you so much. This definitely helps bring this into perspective of what all we can expect. Thank you so much, Dr. Ed. We always appreciate your time.